Hi, my name is David Thompson, and what I chose is Office Ergonomics. Alright, some of the training objectives is what is ergonomics? How does ergonomics relate to your workplace? What are some workplace injuries associated with improper ergonomics? And what are the guidelines for setting up an ergonomic friendly workspace? What is ergonomics? It is the interaction between you and your work environment. It is all about designing a work environment to fit people comfortably. The primary goal of ergonomics is to decrease the danger of a work-related musculoskeletal disorder or WMSD. Here are some goals of ergonomics: increased worker efficiency and performance, decreased employee discomfort, improve the complete quality of the employment atmosphere. Related workplace injuries. Administrative work increasingly involves extended use of computers. As a result, managers and supervisors are becoming aware of possible injuries from incorrect computer workstation interface. Such injuries are collectively referred to as work-related musculoskeletal disorder. WMSD occurs from repeated physical movements doing damage to tendons, nerves, muscles, and other soft body tissues resulting from the typical tasks they perform. Each is potentially serious, and each of these ailments can happen even more quickly as a result of typing techniques and body positions that place unnecessary stress on the hands, wrists, arms, shoulders, and neck. And some of the examples are carpal tunnel syndrome, tendonitis, and Raynaud's syndrome. What are some of the work-related disorders? It affects the muscles, nerves, and tendons, including those of the neck, upper extremities, and low back. They are one of the leading causes of lost workday injury and illness. Workers in many different industries and occupations can be exposed to risk factors at work, such as lifting heavy items, bending, reaching overhead, pushing and pulling heavy loads, working in awkward body positions, and performing the same or similar tasks repetitively. Exposure to these known risk factors for WMSDs increases a worker's risk of injury. Work-related WMSDs are among the most frequently reported causes of lost or restricted work time. In 2011, the Bureau of Labor Statistics reported that industries with the highest WMSD rates include healthcare, transportation, and warehousing, retail and wholesale trade, and construction. According to BLS, the 387,820 MSD cases accounted for 33% of all worker injury and illness cases in 2011. Setting up your workstation. There is no single correct posture or workstation arrangement that will fit everyone. No two bodies are identical, so no one setup is the best for you. However, there are basic design guidelines you can use to set up your workstation in a way that best fits your stature and provides you with the most comfort. As you go through the following slides, consider your workstation and see if you can identify areas for improvement in posture, component placement, or work environment adjustment. The correct setup might not feel right immediately, and changing ingrained habits may take an effort. However, to give corrective measures the best possible chance, allow a new setup some time to see how it will work before you discard any one idea. Of course, if the adjustments or new equipment cause you pain, you should reconsider your arrangement immediately. The chair is probably the most important part of setting up a computer's workstation. Another setup would be the monitor. Adjust the height of the monitor so that your direct line of sight hits the top of the monitor. If you need to raise the monitor, you can use anything suitable that you have on hand, such as a CPU or a sturdy container. The distance to the monitor should be no closer than arm's length and as far away as possible, while still being able to read clearly. Longer distances relax the eyes, with the perfect distance being between 20 to 40 inches away from the eyes to the computer screen. There are bifocals and computer use. Bifocals are typically engineered so that only the lower part of the lens is used for reading. This works for reading materials flat on a desk. However, if a worker uses bifocals to look at a computer monitor, they may have to tip their head back. Over time, this can create problems such as neck problems. If you find yourself in this situation, here are some things to try. Along with your doctor, consider a more appropriate prescription. Move your monitor further back so that you can view it through the upper part of your lens. Increase the font size, or lower your monitor and move it close enough so that it is in the field of view of the reading part of your lens. Positioning yourself. Sit close to the desk and don't put things between you and the keyboard except a gel wrist rest. Your elbows need to be vertical under your shoulders. Don't automatically use the keyboard's rear feet. You only need them if your elbows are below desk height. If you rest your wrist on the table when you type, you should use a wrist rest. Position and use the mouse as close to the keyboard as possible. Aim to have your elbow vertically under your shoulder and right by your side or on the armrest. Here are some do's and don'ts of input devices. The mouse comes in many shapes, sizes, and with different interface features. However, good ergonomic principles when using the mouse are similar, if not the same, to each. There are 3 don'ts to input devices and one that you should do. Don't use a tight grip. Just move it gently over the surface. Don't flip the mouse with your wrist. Instead, make controlled mouse movements with your elbow. And don't stretch. The mouse should be positioned so you don't have to reach across your desk. And then the one thing that you should do is position the mouse correctly. Taking a break. Working in the same position for long periods of time at a computer puts your muscles at risk under constant strain, reducing blood flow and oxygen to hard working tissues. It helps to take a break by alternating the types of tasks you perform throughout the day. And here are some breaks to consider: eye breaks, micro breaks, and rest breaks. With the eye breaks, take every 15 minutes, look away from the screen for a minute or 2, shifting your line of sight to a more distant scene. Micro breaks is about less than 2 minutes. You can stand up, move around, do different work tasks like making a phone call, filing, or any other that does not involve keyboarding and mousing. And then the last one is rest breaks. Every 30 to 60 minutes, you should take a brief break. Lighting. Eye strain means different things to different people. It can be experienced as burning, tightness, sharp pains, dull pains, watering, blurring, double vision, headaches, and other sensations. Depending on the person, if you have any eye discomfort caused by viewing something, you can call it eye strain. You should minimize direct glare caused by lighting in your line of sight, minimize reflected glare on your computer screen, minimize the contrast. And the amount of light you use is going to depend on your age, the quality of the print you're reading, and other factors. Here is a checklist for everyone to do. It will help you determine if your work environment is ergonomic.